Nurse Awesome. Let's have the first video in this communication series. We're going to talk about talking to doctors. The reason I picked this one first is because it's the thing that gave me the most trouble as a nursing student and then as a new nurse. Wow. The very first time I had to talk to a doctor, I did a horrible job. It was in first semester. I stumbled completely over my words. I was not prepared for the information he needed. I didn't know how to find it in the MAR. I didn't have it written down. It was awful. But I knew because I did such an awful job, it was something that I needed to practice a lot because as a nurse, I was going to be doing it a lot, right? So, first bit of advice that I can give you, be the person that volunteers to call the doctor while you're in school, while you have kind of the protection of other nurses and your nursing instructor, while you have the helping hand that is readily available, while you have a little more time to kind of focus on gathering data before you call them. Volunteer. I promise you, when you get out into the real world, it will help you so much because that's what I did. And by the time I got out into the world of nursing with my very own license, talking to doctors wasn't near as intimidating as what it was when I was in school. Here are a few things that can help you do a better job talking to doctors. First things first, make sure you're calling the right doctor. If they're a surgical patient and it's an issue that pertains to the surgery, call the surgeon. If it's an oncology patient, call the oncologist. Don't call the wrong doctor because that's just going to waste everyone's time. Second thing, use SBAR when you're communicating with the doctor, just like you do when you're communicating with other nurses. If you don't know what the SBAR technique for communication is, just Google it. RN to doctor communication using SBAR, and you'll get some really groovy templates that other people have created that will help you lose your jitters. They'll kind of prompt you through what you need to say. And if you have to, the first few times, the first 20 times, use the template exactly and talk to the doctor via the template. It's going to help you and you'll get the hang of it a lot better. Third thing, super important, be in front of the chart when you call the doctor. Don't call and then run off to your lunch or break. Don't call and then go into another patient's room to do a very lengthy assessment. That is just plain rude, you guys. Be respectful of the doctor's time. They have a lot of stuff to do, just like you. And if you're not in front of the chart and they ask you a question you're not going to be able to answer, then you're going to stumble. You're going to feel really inept. They're going to think you're inept. And they're going to kind of be pissy with you because you're wasting their time. Just don't do it. Be in front of the chart because efficiency counts, y'all. Next thing, look at the orders, the protocols, all of that before you call the doctor. Sometimes in nursing school, we're so overwhelmed with learning so much stuff that we don't take time when we're looking at the medication administration record to actually look at the PRN medications and what they're for and those parameters. As a new nurse, I learned really quickly that PRN list was like, it was like my golden ticket to taking care of the patient before I had to call the doctor. Because doctors lots of times anticipate certain things happening to their patient like hypertension or electrolytes that are out of balance or chest pain or the need for oxygen or that list could go on and on. There are different things that they do that they call like standard order sets or protocol. And while there are a lot of states that are kind of moving away from that, a lot of doctors use those kind of blanket orders for those types of situations. So look at the PRN medications at the very beginning of your shift. What's the doctor empowered you to do? Know those things, and please do those things before you call the doctor. So for example, if your patient has hypertension and you have an order for hydralazine to treat that, do that before you call the doctor and say, hey, Dr. Smith, your patient has hypertension and I don't know what to do about it. Because the first thing he's going to say is, did you use the hydralazine I ordered? The better thing to do is to say, hey, Dr. Smith, I'm treating your patient, whoever, and here's what's going on with them, and I've used hydralazine to treat their blood pressure. The systolic is 180. It came down to 175, but it's not coming down below that. What else can I do, right? You want to have taken that first step based on the order set, the protocol, the PRN medications before you call Dr. Awesome. Because if you don't, You might kind of get some of that gruffness that you don't want. Next thing, critically think first before you call the doctor as you're gathering information. What information is he going to need? Decide if you use the PRN medications effectively. Decide what you're going to say in the SBAR. Decide whether or not this is something you can treat before you call the doctor. Is there something else you can do? Make sure you have the latest data. If you call a doctor and ask for, let's say, a pain medication, and they're gonna, first thing they're gonna want to know is the vital signs of the patient, like what's the respirations, what's their heart rate, what's their blood pressure, and you say, well, 2 hours ago his respirations were 12. What are his respirations now? That's the information that's important. Remember here too, guys, objective data. The doctor doesn't care about a lot of subjective crap. He wants to know the facts. And that's what you should be telling him, just the facts. Okay, another thing that I can give you a little bit of tip, ask other nurses before you call, especially while you're in school. This is super helpful. You sort of get the hang of what different doctors want. Nurses work with these doctors all the time, so they're going to be able to tell you what Dr. Smith wants, sometimes, not all the time. So they'll know, oh, no, he has a standing order for hydralazine for his patients that have systolics over 165. Or, no, he doesn't care if you order an EKG for chest pain. He's going to want you to do that first. He must have just forgot to order it. So critically think here before you decide to take another nurse's word for something. Is that intervention that you're going to do something that's going to harm the patient? Well, doing an EKG on someone with chest pain is probably not going to harm them. So that's a pretty safe decision for you to make. Even if Dr. Smith says, why the hell did you order an EKG? That was stupid. You haven't harmed the patient, right? But if, on the other hand, you decide to give hydralazine because another nurse says, oh, Dr. Smith always gives hydralazine to his patients that have hypertension, and that particular patient has some sort of reaction to that or does poorly with that. I mean, giving a medication can cause harm, right? That's something you really need to check with the doctor for before you just take someone else's word for it. All right, so I have blabbered on enough here. Talking to doctors really doesn't need to be something so scary and mystic, They're just people like you and me. They want for you to be efficient and effective. But, if you think about it, that's the kind of communication that you want from other nurses and from doctors, right? I mean, be clear with what you say. Be concise. They are busy people. Don't get offended if you say, I'm taking care of your patient in 850, and they have no idea who you're talking about. You have 5 patients. They probably have 50. You need to give them objective data in a professional way that is very concise. That's the way that you're going to make lots of friends with doctors. No, I'm just kidding. That's the way you're going to keep from getting that bark that so many people are afraid of from doctors. That's the way that you're going to feel a lot more empowered to talk to doctors without being scared. And that's the way your patients are probably going to get the very best care from you, as if you're not really intimidated by talking to doctors. Next time we'll talk about rapping with other nurses. Until then, you guys use SBAR to talk to your doctors and do it a lot this semester, okay? Have a awesome semester. Until next time, peace, y'all.